Okay, so we have finished with the venous and arterial supply of the upper limb, the lower limb, and now I'll be starting with the head and neck. This is the venous supply, right? So from inferior sagittal sinus, if you remember, we had those dural venous sinuses in our brain. We have inferior sagittal sinus and superior sagittal sinus. Those two sickle shaped sinuses. Okay, so this inferior sagittal sinus drains into the straight sinus, and there is this occipital sinus along with superior sagittal sinus. These three, straight sinus, occipital sinus, and superior sagittal sinus, will drain into confluence of sinuses. If you remember the interior of skull, there is a place where the confluence of sinuses, where all these sinuses meet, and then these confluence of sinuses will divide into two, the transverse sinuses. This transverse sinus will furthermore drain into the sigmoid sinus, and from sigmoid sinus here comes your foramen magnum. Out of foramen magnum will be formed your internal jugular vein. Alright, so again, in your brain, the dural venous sinuses, we had the superior sagittal sinus, the inferior sagittal sinus, and occipital sinuses. So inferior sagittal sinus drains into the straight sinus. This straight sinus along with occipital sinus and superior sagittal sinus will drain into confluence of sinuses, which further drains into transverse sinus, further goes into sigmoid sinus, and from here sigmoid sinus from foramen magnum turns out to be your internal jugular vein. Now what else drains into internal jugular vein? It's not that just the brain part has the venous supply, we also have the facial part. So we have two veins, the ophthalmic vein, that is obviously from the eyes, and the facial vein from the face. They both drain into the cavernous sinus. Remember the cavernous sinus next to the pineal gland, sphenoid sinuses. So this very important cavernous sinus, ophthalmic vein and facial vein, will drain into the cavernous sinus. This cavernous sinus again splits into two, forming the superior petrosal sinus and inferior petrosal sinus. Cavernous sinus, superior petrosal sinus, and inferior petrosal sinus. Now superior petrosal sinus will drain into our sigmoid sinus, while inferior petrosal sinus, superficial temporal sinus, and facial vein will drain into the internal jugular vein. Ophthalmic vein plus facial vein will drain into cavernous sinus. Cavernous sinus splits into two, the superior petrosal sinus and inferior petrosal sinus. Superior petrosal sinus will drain into sigmoid, while inferior petrosal sinus, superficial temporal sinus, and facial vein will drain into internal jugular vein. This is a very commonly asked multiple choice question, that superior petrosal sinus drains into sigmoid, so SS, while inferior into I, internal jugular vein, inferior petrosal sinus. If we remember, we also have the occipital vein. Now occipital vein and sinus are two different things. So occipital vein will drain into your posterior auricular vein. Now these were the branches of external carotid artery, occipital artery, posterior auricular artery. So we'll have those similar naming veins, occipital vein, posterior auricular vein. These two will drain into external jugular vein. Now obviously when we have internal jugular vein, we will also have external jugular vein. This external jugular vein will drain into the subclavian vein. If you go back to our video of upper limb, the upper limb, we ended at the subclavian vein. So this external jugular vein draining the vein blood from the back of the skull, this from inside of the skull, again from the inside of the skull into internal jugular vein. From the back we have the occipital and external jugular vein will drain into subclavian vein. What else drains into subclavian vein? The vertebral veins. We had the vertebral arteries. So vertebral vein, external jugular vein will drain into subclavian vein. Furthermore, what drains into the subclavian vein? The internal jugular vein and the subclavian vein together will drain into the brachiocephalic vein. And this brachiocephalic vein will drain into the superior vena cava, draining into our right atrium of the heart. So this is the entire flow chart of venous drainage of our brain.